Encik Azlan here.
Yeah. Hi, how are you?
Heading to Caring Pharmacy, right?
Yep, that's right.
Okay. Wow, balik from hospital, straight to pharmacy ah. Why ah? Here got no medicine ah.
I'm just here to see the doctor actually to get my prescription. It's more convenient for me to get my medicine from Caring.
Hey, but why more convenient? You have to go to two places, right? If it's me, I think I forgot to take my medicine already.
Oh, I use my health record in the Caring app. Everything is at my fingertips.
Wow, got such a one ah. What does it do? Can you share with me more?
Oh, it's quite easy actually. Now, let me explain. My health record is an electronic record system that helps me record all my medical data, including the medication I'm taking. It helps me better manage my health because it allows the pharmacist to consistently review my medication. The doctor can also better understand my condition by looking at my health record. For example, they can check my blood pressure and blood glucose readings. So convenient, right? Saves the doctor time on looking for files too. Also, my health record helps to streamline my medical care between all parties. Don't worry, it is very safe and secure to keep all our medical data private and confidential. So many features, right? Hey, stop. We're here already.
Oh, let me find parking. I'll join you inside.
Ah, okay. Sure. Manage your health better with My Health Record. Like me. Sign up at your nearest Caring today.
Encik Amma here.
Yeah, hi.
Wow, so many medicine ah.
Yeah, need to stock up.
Huh? Then you should know about carrying My Health Record app. Come, I tell you. Encik Azlan here.
Yeah. Hi, how are you?
Heading to Caring Pharmacy, right?
Yep, that's right.
Okay. Wow, balik from hospital, straight to pharmacy ah. Why ah? Here got no medicine ah.
I'm just here to see the doctor actually to get my prescription. It's more convenient for me to get my medicine from Caring.
Hey, but why more convenient? You have to go to two places, right? If it's me, I think I forgot to take my medicine already.
Oh, I use my health record in the Caring app. Everything is at my fingertips.
Wow, got such a one ah. What does it do? Can you share with me more?
Oh, it's quite easy actually. Now, let me explain. My health record is an electronic record system that helps me record all my medical data, including the medication I'm taking. It helps me better manage my health because it allows the pharmacist to consistently review my medication. The doctor can also better understand my condition by looking at my health record. For example, they can check my blood pressure and blood glucose readings. So convenient, right? Saves the doctor time on looking for files too. Also, my health record helps to streamline my medical care between all parties. Don't worry, it is very safe and secure to keep all our medical data private and confidential. So many features, right? Hey, stop. We're here already.
Oh, let me find parking. I'll join you inside.
Ah, okay. Sure. Manage your health better with My Health Record. Like me. Sign up at your nearest Caring today.
Encik Amma here.
Yeah, hi.
Wow, so many medicine ah.
Yeah, need to stock up.
Huh? Then you should know about carrying My Health Record app. Come, I tell you. Encik Azlan here.
Yeah. Hi, how are you?
Heading to Caring Pharmacy, right?
Yep, that's right.
Okay. Wow, balik from hospital, straight to pharmacy ah. Why ah? Here got no medicine ah.
I'm just here to see the doctor actually to get my prescription. It's more convenient for me to get my medicine from Caring.
Hey, but why more convenient? You have to go to two places, right? If it's me, I think I forgot to take my medicine already.
Oh, I use my health record in the Caring app. Everything is at my fingertips.
Wow, got such a one ah. What does it do? Can you share with me more?
Oh, it's quite easy actually. Now, let me explain. My health record is an electronic record system that helps me record all my medical data, including the medication I'm taking. It helps me better manage my health because it allows the pharmacist to consistently review my medication. The doctor can also better understand my condition by looking at my health record. For example, they can check my blood pressure and blood glucose readings. So convenient, right? Saves the doctor time on looking for files too. Also, my health record helps to streamline my medical care between all parties. Don't worry, it is very safe and secure to keep all our medical data private and confidential. So many features, right? Hey, stop. We're here already.
Oh, let me find parking. I'll join you inside.
Ah, okay. Sure. Manage your health better with My Health Record. Like me. Sign up at your nearest caring today.
Encik Amma, yeah?
Yeah, hi.
Wow, so many medicine.
Yeah, need to stock up.
Huh? Then you should know about carrying My Health Record app. Come, I tell you. Encik Azlan here.
Yeah. Hi, how are you?
Heading to Caring Pharmacy, right?
Yep, that's right.
Okay. Wow, balik from hospital, straight to pharmacy. Why? Here got no medicine.
I'm just here to see the doctor actually to get my prescription. It's more convenient for me to get my medicine from Caring.
Hey, but why more convenient? You have to go to two places, right? If it's me, I think I forgot to take my medicine already.
Oh, I use my health record in the Caring app. Everything is at my fingertips.
Wow, got such a one. What does it do? Can you share with me more?
Oh, it's quite easy actually. Now, let me explain. My health record is an electronic record system that helps me record all my medical data, including the medication I'm taking. It helps me better manage my health because it allows the pharmacist to consistently review my medication. The doctor can also better understand my condition by looking at my health record. For example, they can check my blood pressure and blood glucose readings. So convenient, right? Saves the doctor time on looking for files too. Also, my health record helps to streamline my medical care between all parties. Don't worry, it is very safe and secure to keep all our medical data private and confidential. So many features, right? Hey, stop. We're here already.
Oh, let me find parking. I'll join you inside.
Ah, okay. Sure. Manage your health better with My Health Record. Like me. Sign up at your nearest caring today.
Encik Amma, yeah?
Yeah, hi.
Wow, so many medicine.
Yeah, need to stock up.
Huh? Then you should know about carrying My Health Record app. Come, I tell you.
Hi everyone, good evening, and thank you very much for tuning in to our live stream. My name is Willie, and I'm a caring pharmacist. Hope you guys are enjoying your weekends. How are you spending this lovely Saturday? Comment down below and give me some ideas of what I can do after this live stream. Well, besides going online and binge buying. Anyway, we are back with another interesting topic, one which is rarely discussed yet requires more attention, which is managing asthma in children. So if you have any families or friends who have children suffering from asthma, let them know about this live stream ASAP, and I mean it. Press the share button and tag them in now, because we will be sharing some important information and tips regarding this subject. I have someone really knowledgeable about asthma in children with me today. She is a consultant pediatrician in Subang Jaya Medical Centre. So, if you have any questions, shoot it down in the comment box below and our expert will answer them for you. Without further ado, let us welcome our guest for today, Dr. Khoo. Hi, Dr. Khoo.
Hi, everybody. Hi, Willie.
Hi.
Hi.
How have you been?
Hi. Been well, Willie. Thank you. And thanks for the invitation to be sharing this session with
Okay.
the audience, and hopefully I can just answer as many questions as I can. So please keep them coming in, dads and mums.
Yeah. So how has been the CMCO? Are you getting more worried parents nowadays?
Well, parents will always be like concerned for their children, but I think with the CMCO, people are not going to school so much, and they are staying away from daycare. So in fact, the number of illnesses in children are actually lesser than before, because when they keep away from crowds and in like play schools and all that, you're not only keeping away the COVID virus, but you're keeping away other viruses as well. So they are generally healthy, but parents are still very concerned. Sometimes they are too concerned, and they avoid bringing, let's say, the child to the hospitals or to the clinics for, let's say, all the jabs and the immunizations that are due. So may I please stress that you don't neglect that. Make sure that they take their jabs on time, and make sure. I mean, we do make sure that the situations and in the hospitals and in the clinics are always, well controlled. There's always an SOP. There's always distancing. There'll be temperature checks and all that. So please don't worry. Whatever you need to do for your child, please come.
Yes. So to our viewers, if you have anything that you really need to bring them to the hospital, don't worry and bring them in, because they have proper SOP that they follow. So Dr. Khoo, you have been a consultant pediatrician for how long now?
Really, I've been a consultant pediatrician now for a good very many years. I'd say easily 20 years now.
Wow.
Yeah. And audience, I just want to share something personal now. When I came in and met Willie, it was such a pleasant surprise to find out that his 6-year-old son saw me before when he was a baby. And now here we are, Willie.
Yeah, 6
the
years
host
has passed.
of this session is such a pleasant encounter,
Yes.
Yeah, so yeah, there we go, a personal sort of sharing.
Okay, so since you have been a consultant pediatrician for so long, I'm sure you have seen many asthma cases. So let me start with the first question. What would you say, doctor, about the prevalence in asthma?
Well, asthma is a very common condition, actually. It's not only a condition which is prevalent in Malaysia, but it is a worldwide concern. It's a health concern. I mean, asthma is not just localized to country, as we all know. So just for the sake of the audience, just to roughly know what is asthma, it is an allergic condition affecting the airways, particularly the lower airways, which means the lungs, the lung area, and it is a global health concern. So if you can just quickly look at the slide which is flashed in front of you, what we see is that it is everywhere, and the different colored sort of coding denotes countries whereby the incidence of asthma is actually higher and where they are lower. And of course, there may be some countries whereby there's no color code, but that's because maybe they don't have so much statistics. And if you notice the, let's say, the dark colored, the red areas whereby the incidence of asthma is highest, you actually do notice that it is in many of the developed countries. So for all we know, I mean, the statistics there could be better, the collection of statistics are better, but sometimes we feel that with the development of the country and so forth, with modernization and so forth, there could be actually be leading to an increase of allergic disorders, one of which is asthma. So it is a global health concern.
Wow, this is relatively high. So what about the patients in your clinic? Could you maybe share with us a rough percentage of asthma patients in your clinic?
Yeah, I can, but just to say to you that Malaysia also has got easily at least 2 million asthmatics, in the population. And then the incidence of asthma has actually been gradually increasing over the years. Before Malaysia became so-called a more developed country, the incidence of asthma and allergic disorders was a little bit lower. And as the years went by, we seem to see an increasing number of this sort of disorders, which include asthma. They also include sinus, which is allergic rhinitis, and another sort of condition, which is allergic skin, called eczema. So as the years pass, we have more. But in my clinic, I'd say that I also do see a fair number. I sometimes will not categorize to see whether you're asthmatic, because sometimes when parents hear that, they feel very alarmed. It's just like a label. Oh, my child is asthmatic. So many children with asthma don't present with the the common symptoms that we associate with asthma. Things like wheezing, short of breath, you can't talk, and all that. That one will be considered very serious asthma attack. But you have to consider asthma, which is a bit more subtle. Which is a bit more subtle, and by that, let me just explain to you, parents, that by subtle, it doesn't have to. You don't want your child to come in with a full-blown asthma attack. Okay, just to remember that asthma is more common in families whereby there's a family history, because it is a genetic disorder. So there's a risk which is increased if you have a family member. It doesn't have to be your mother or father. It can be some relative also with allergic disorders like. Sometimes not even like asthma. They say, oh, I don't have anyone with asthma, but I have, my grandfather has got sinus, he's sneezing every morning and all that.
I see.
Because this is called the allergic triangle. So the allergic triangle is like that. Asthma is on the top of the triangle because it's the most serious. Come down to allergic rhinitis, which is sinus, a sensitive nose that some children sneeze all the time. And then the third one is eczema, which is sensitive skin. So these sort of children have dry, scaly skin, which is itchy. But they're all part of one sort of
triangle,
same
which is family.
Same spectrum, same genetics.
I see.
Yeah.
So you have mentioned that there are signs and symptoms of asthma which are quite subtle, and some parents may miss it. They may not be able to know whether their child is having asthma or not. Why not we go to asking, what exactly is asthma? What are the signs and symptoms for parents to look at in their childhood, their children for asthma? Are they any different from adults?
Well, in children, as I've said, really the most subtle signs of asthma, you don't want to wait for the child to come in with a wheeze and they can't breathe and all that. The most subtle signs, especially those days when children went to preschool and schools, is that they always come in with a cough. So they always tend to cough easily, and many a time the cough is worse at night.
Oh, okay.
But in the daytime, they don't cough so much. Some of them may also have a bit of sensitive nose, so they tend to sneeze in the morning. And some of the child don't cough at all, but the parents say, oh, doctor, the child tends to cough more when he's running, or when he's laughing, or when he's like having like emotional outbursts, like then he starts to cough. And some children don't cough at all, really until the middle of the night, 3-4 a.m. So in that sort of instances, we have to be like a little bit more aware, especially if there's a family history.
Okay.
Because, like let's say if it's a normal flu and cough, usually let's say you catch a flu and cough from your friend or whoever it was from the environment, then usually the cough is through the day. But asthma is a bit more special. It tends more towards the night, sneezing in the early morning. It comes around on exertion, especially. And sometimes the cough is so bad that the child produces so much phlegm that they vomit. So the parents say, oh, always whenever he coughs, he tends to vomit. So these are all early signs of, I'm not saying every one of these have asthma, but you have to be a bit more careful, especially if you have a family history.
Yeah, okay.
So you have to be aware.
So I hope the viewers are taking note, and if your children are having coughs more at night and maybe runny nose in the morning more often, maybe you have to take note. Yeah. Okay. So what are the common causes or triggers of asthma?
Well, asthma is considered an allergic airway disease.
Yeah.
All right. So it affects the lower airway. So that is the reason why we cannot breathe. Common triggers for asthma can be usually things that we inhale, breathe in through our nose, or it can be things that we eat. Okay. Generally, I would say the commonest sort of trigger for asthma is actually airway infection. Like any common viral infections. Let's say our child goes to, because parents work, they have to go to daycare or preschool. Then they get some sort of virus from the environment, and they start to have flu and cough. That is a trigger for asthma. And the other triggers sometimes would be, let's say, a very dusty environment. Let's say you have a lot of carpets at home, and then you find it difficult to always like vacuum them. That will be airborne allergens. Then the other one is food allergens. Sometimes certain types of food can actually trigger an asthmatic attack. So these are all things that we have to bear in mind. Like even pets. I mean, some pets are okay, some pets are not okay. But there are allergy tests that we can actually do to determine whether that child or that patient has got a sensitivity to that pet.
So it sounds like things which are so common, which is in everyday what we have, like even carpets or fabrics, they actually may be a trigger for asthma.
Yes,
So
yes,
that's
yes.
actually very common.
Yes.
Okay, doctor, I have a question from Emily Moy.
Hi, Emily.
Okay, will air purifier help to reduce allergy? Any specific purifier can help.
Hi, Emily. Thanks for that question. The importance of a clean environment cannot be overemphasized for asthma because, as you know, the airways are so sensitive. So, in allergens and all that, irritants and all that might trigger an asthma attack. But my answer to your question, Emily, would be like this. Sometimes instead of saying that you just install an air purifier in the room, actually I would recommend that you do regular cleaning of the room, as in regular, I'm not just saying sweeping, you must be regular mopping, making sure that the dust in the environment is not floating around. Things like, try not to keep the room too cluttered because, those are dust collectors, sometimes too many toys, like heavy curtains and all that. So keep the room simple. Try and do regular cleaning every day if possible. But in the event that you really can't, of course, everyone tries, but but once we get back to the normal sort of norm that we, go out and work and we don't work so much at home and all that, then if you really are stuck for time, then I suppose an air purifier may help. I will leave the brands aside because that depends on your budget, etc. But generally, I would emphasize more on regular cleaning and making sure the environment is clean rather than just buying an air sanitizer or air purifier. On that same note, like let's say if you install an air conditioning in the room for your child, make sure the air cons are serviced regularly. Make sure if you can, take down the filters yourself, maybe on a monthly or a fortnightly basis. Give them a wash, but get them properly chemically serviced regularly so that the air that you breathe every night when you sleep is clean and fresh.
Yeah, okay.
And keep windows open whenever possible.
Fresh air.
Fresh air is most important.
Okay. So, another question from Sindhu Subramaniam.
Hi, Sindhu.
Okay. Sorry. Doctor, I've seen many types of inhaler. Do each has different function and medication?
Yes, Sindhu, the inhalers, they do have different functions. Usually the two main categories of inhalers are one is called a reliever inhaler and the other one is called a controller inhaler. So when we look at asthma sort of management, we have to look at it from a point of quick relief when the child is wheezing away, can't breathe. So you want the child to be able to get them enough oxygen and not like feeling so distressed. And then later you want to be able to prevent the child from getting further attacks in the future. Because asthma is not just a one-off thing that comes just once, twice. It is a recurrent thing which can actually go on for years. So our purpose when we manage asthma is to manage the acute attack, which is one type of inhaler called a reliever inhaler. And then we want to prevent further attacks using another type of inhaler, which is called a controller inhaler.
Okay. So back to our questions. Another one is if that's the case, is asthma curable, or is there any way that a child can outgrow childhood asthma?
Generally speaking, asthma is not curable. All right, because you cannot just say, "Oh, I give you this. It's just like an antibiotic. I give you this. You get better in 2 days or 3 days." Blah blah and all that. Not at all, because asthma can sometimes be very well for a while. Let's say, let me give you an example of what happens. Let's say for a child. Let's say a child who's got childhood asthma. You have, let's say, an acute attack quite a few attacks because you're from daycare for the first 2-3 years. And then after a while, because you've built up a little bit of immunity against these viral attacks, so you don't get the trigger anymore. And therefore, you are quite well for a while. And then when you reach your 12, 13, which is your teenage years, because of the hormonal influences that some of us have in our children, and some of them get very emotional, how teenagers are, that can also be a trigger for the asthma to come back. So what I want to put across to your parents when you manage these sort of children, your children, is that don't take for granted that, it's just going to be a childhood asthma. He will, when he grows up to maybe 7 years old, when he goes to school, he'll be all right. We cannot take these things for granted, but neither am I saying you get too kanchong and you panic and all that. You just go for the regular checkups, advice, whatever, do your home environment as best as you can. And then the attacks will definitely get less as they grow older, but we're not guaranteeing that you will not get any more attacks. So in essence, asthma cannot be cured. But it can be controlled and it can be managed well.
Okay. If that's the case, then just now you answered to the Sindhu, right? About the medication.
Yes, indeed.
So you said that there will be a reliever and there will be a controller as well. Yeah. Okay. Then what are some of the consequences of asthma in the long run? Yeah, if it is not managed well.
Yeah. So what happens? Why does asthma occur? Asthma is actually a reaction of your airways to allergens. So allergens, by that I meant food allergens, air allergens, viral allergens. Okay. So what happens is that the airway is, let's say our airway is like that. So what happens with asthma is that when there's inflammation, then the airways get really narrower. Okay? So when you get this sort of narrow airway with a lot of phlegm being produced, that's the reason why we have difficulty in breathing and all that sort of thing. So if it gets prolonged, this inflammation does not reverse. That means the inflammation stays. And then that might lead to permanent lung damage. So it's just the same as like when you have a heart attack, right? The muscles of the heart get damaged. And then, you of course get the patient better from the heart attack. I mean, he survives and all that. But the heart will be weakened from that heart attack. So equally with asthma, when there's inflammation of the airways, if you don't look after it properly, there will be remodeling of the airways, and then there will be permanent inflammation. So that will lead to poor lung function as an adult. Right? So we have to be careful, even starting from young. Don't take things for granted.
So what Dr. Khoo means is that we have to control asthma as early on as possible in order to avoid the condition getting worse and uncontrollable further on in life.
Yes.
Yeah. So I understand that some nebulizers are used as a quick relief treatment for children with asthma. Right. There are many customers who were confused if using the nebulizer is the same as using an inhaler. Maybe you can clear up that confusion for us, please. Before that, guys, please remember to answer the question pinned at the comment box below. The question is, can children still perform physical activities if they have asthma? Okay. Hashtag Caring Pharmacy and hashtag Omron and comment them together with your answer. We will then select NPM, 5 winners. Okay, 5 winners of this Omron thermometer with the most accurate answer. And don't forget to like, share and tag 3 of your friends to increase your chances of winning. Okay, sorry doctor.
No problem. So people, please put in your answers to get all these lovely thermometers. You were saying really about the
nebulizer. Is that yes? People they are confused with using nebulizer and inhaler. Are they the same or?
Okay, basically the nebulizer and the inhaler usually with the usage of a spacer essentially deliver drug means medication directly into the lungs. The latest teaching about management of asthma is no longer taking cough syrup, not taking any sort of pills or whatever, just because that one is a long about route. Okay, you have to take it into your mouth, it goes into your stomach, then it has to get absorbed into the bloodstream before it goes into your lungs. So that one is now we consider not the preferred route. Whatever, when we want to administer medication, it has to go directly into the lungs. So the inhaler with the spacer is something which is mobile, it's easily carried everywhere, wherever you have the child. And it consists of an inhaler. You know, there are two types of inhalers, as we said before. One is for relief purposes, and the other one is for controller purposes. And the reason for the spacer is that, you know, children, they do not how to coordinate their breathing. So what happens is that if they don't breathe out and then take a deep breath in, the medication will not get properly into the lungs. So for that reason, there are lots of spacers which are being sold, and that facilitates the passage of the medication from the inhaler into the spacer and subsequently into the child's lungs. Now, a nebulizer is also doing the same function. It delivers medicine directly into the lung, which is where we want it to be, rather than taking things orally. But it is more like a machine whereby it vaporizes the liquid medication, which is meant to help our lungs, into fine droplets so that it can enter our airways. Where it is needed, where the child is like short of breath and so forth, the medicine should be there. ASAP, as in as soon as possible, so that relief is immediate.
Okay, I believe that our audiences now have a better understanding between the differences of the two treatments. So, what are some of the benefits of using a nebulizer?
Yeah, okay. I mean, the benefits would be such, because sometimes when you realize, I mean, some of you people out there in the audience who have children with asthma, who have the inhaler and the spacer at home, sometimes you find that, the child is struggling away, especially when you try and put the mask over the child's face, and then in that quick second where you puff once, the child turns away, then let's say the doctor says 3 puffs, and then you have to puff a second time, the child is struggling and crying away. So when they're crying also, they don't really take enough of a deep breath to get enough of the medication from the inhaler into the lungs. So in that sense, sometimes a spacer is less useful or a bit more tough to use for children who are not so cooperative, really. So for the nebulizer, the whole process is a wee bit longer, because when you nebulize the liquid into this sort of droplets, fine droplets for passage into the lung, you need to hold it over the child's face and mouth, the nose, I mean, so that the inhalation is there, and then it takes a little bit longer, so it gives enough time for the medication to go into the lungs. So both are good. Both deliver medications into the lungs, which is what we want, but that is the inherent difference here. So I think nebulizers are a little bit more useful for those who are a bit more difficult with inhalers.
Okay, I see.
Yeah.
So nebulizers manage to deliver the medication deeper into the lungs for for them to take effect. And even in my pharmacy, I do understand there are a lot of technical issues when it comes to using an inhaler as well. So for those who, for children who are not cooperative, then they may benefit better from the nebulizer, right? So, sorry, doctor, there's another question from the audience.
Sure.
Emily Moy again. So, how old will the child show asthma symptom?
Hi Emily, thanks again for your interest in this afternoon's Facebook thingy. Well, it's difficult to say. They may not show it till later. On the other hand, they may actually not really show it hugely that they start wheezing away in the first year of life. I would say that if the family history is very strong for asthma, let's say both parents are asthmatic. I mean, I'm just giving you a scenario here, Emily. Let's say both parents are asthmatic. The child goes to daycare early, gets some sort of respiratory infection, especially this sort of infection, which is called RSV, which is respiratory syncytial virus, which is a virus which also attacks the airways and causing them to wheeze. That itself is like a precursor, which means like a little warning that your child may develop asthma, as they go along, because again, there's family history positive and all that. So again, very difficult. So you cannot say that, oh, my child is all right for the first 2 years, therefore asthma free and all that. It can come basically at any time at Emily. So, but just be aware that, let's say if you have a family history, just be a bit more aware of it. If there's no family history, of course, it doesn't mean that you won't get it, but the risk is definitely lower. Yeah.
Okay, there's another question from Shazi app. Hello, Dr. Khoo. Any advice on taking supplement to help with reducing the asthma attack, or any specific diet?
Hi there. Thank you for that question. It's always being asked. I'd say there's no magic supplement that we can take to reduce asthma. You know, I'm a pediatrician and I see children from birth. So one of the first things that I must advise your mothers, young mothers or mothers-to-be is breastfeed your baby. Breastfeed your baby. I know all mothers know the benefits of breastfeeding, but now, you want to talk about some supplement for asthma, breastfeed lah. Breastfeed as and when, from the beginning as much as you can, and then if you can't, then of course there's always a plan B. But supplements, no, nothing magical about supplements. And the diet that we want to, let's say, recommend for asthma is nothing more than a balanced diet. A good amount of, the usual, the protein, carbohydrate, fats, and all that, usually the food pyramid, the balanced diet. But do not forget to give the child fruits and vegetables. Because what is, I find that, sometimes is your child, sometimes I see an asthmatic child with constipation and I say, oh, why is the constipation? Oh, doctor, I don't give the child any fruits. I say, why not fruits? Oh, you cough after take, it's really like sometimes the poor thing, oranges get kena properly. Oh, oranges after take already, the child starts to cough, so I stop all fruits. So not at all, please, a balanced diet. Whether you stop fruits or not, really, it will not help. But the only time when you may want to stop certain types of fruit or whatever is that if it is a specific allergy to that sort of particular fruit. And that can be tested by either an allergy test or skin prick test or whatever. But we don't ask you to ever avoid things if there's no medical reason for it. So the answer is a nice balanced diet.
Okay, balanced diet for good nutrition to keep the child healthy.
Yes.
So, okay, back to our topic. What are the different types of nebulizers are there, doctor?
There are three different types of nebulizer which are in the market. I think two main ones really. One of them is the mesh nebulizer. The second one is the compressor nebulizer, which is I think more common. And the third one is the ultrasonic one, which is I think for all intents and purposes, it's mainly used in hospitals, so you don't have to bother about it. And the differences for those two, I'd say, is that as I've said, compressor is the most common, but it needs a power supply. Usually it's plugged in. It's a bit more noisy. It's a bit more hardy, I'd say, because sometimes clinics also have these sort of compressor nebulizer. Like in the hospitals, we use our nebulizing liquids powered by oxygen, but the compressor machine is the most common. But lately, we have also another type, which is called the mesh, which is more like run by a battery operated. It's a little bit more gentle. It's more silent. The mist that they give out is slightly finer. So I think for a younger child who's frightened off by this very noisy compressor, they're already breathless. They can't breathe, and then this sort of huge thing coming to them. Some of them may get a little bit upset. So the mesh one is a bit more gentle on them. But these are the two main types of nebulizer.
I see. So the differences in the nebulizer are the portability with the mesh, and then the sturdiness of the compressor.
Yes.
And also the mesh one is quieter. Yeah. Okay. Now let's come to the technical part. Right. Feeling like those YouTubers explaining on the electronic devices. Okay. If parents do want to get nebulizer on a standby at home, okay, what are the criteria that you think that they should consider?
Well, I think realistically speaking, you would want to see your budget as well. Okay, just jokes aside now. Okay, see whatever you are comfortable with. You want to see whether you're going to have this nebulizer. Is it for usage at home, or you want to take it with you whenever you travel? you see the age of the child, as I've said, the younger child may be a little bit frightened of by a fairly noisy compressor. And sometimes, for a younger child also, the upper airway, the nose area, sometimes tends to be a bit more like stuffy. So, like some nebulizers, they administer like more steam and all that through the nose as they breathe. Because when we use a nebulizing machine, we put the liquid medication, and also we usually add a little bit of saline, which is salt water, to dilute it further so that, whatever small amount of medication will not be vaporized in 2 minutes, so where the child is just settling down because the medicine is dry already. So you need a bit of saline to dilute it. So when you nebulize saline, it also breaks up the phlegm and the mucus and all that which is in your nose, so it helps the child breathe better. So when you buy a nebulizer, it depends on whether you want to carry it with you, or it's mainly for home usage, for as and when there's an emergency, you don't want to rush to the clinic like in the middle of the night and get a nebulizer. So your needs, you consider your needs, fathers and mothers. But a little thing that I want to really emphasize is that don't take for granted that if you have a nebulizing machine at home, you are A-OK, because that's what doctors do in the hospital. So okay, I'm doing my same already, I'm okay. You must still please bring your child for evaluation by your regular pediatrician or your doctor to make sure that whatever you're doing is right, that whatever medications you're giving is okay, because we don't want to be like taking things for granted, complacent and all that, because that can be a danger, for some parents. So there you go. I mean, it's useful, but please remember to evaluate your child, on a regular basis. Don't just use it and just take things for granted.
Okay, that's good information. And we have another question from the audience, from Jasmine Kalisha. Is asthma will create effects on eczema too?
It's not really to create effects, but the two conditions can coexist. Because remember, I showed you this thing called an allergic triangle, whereby you can have concurrent conditions which are all related to allergies. So you can have a bit of asthma, which is your sensitive lungs. You can have sensitive skin, which is eczema, usually dry skin, a bit itchy. So one does not lead to the other, but it's just in your DNA already that you're a bit more sensitive. So you have to look after the lungs, you also have to look after the skin.
Okay, then there is another question from Chahaya Nuris. What differences between asthma and bronchitis? Because it has similar symptoms, right?
Yes. Now, by definition, asthma is a recurrent allergic condition of your airways. The key word here is recurrent. That means it keeps coming back. I mean, it doesn't have to come back every month or whatever, but there's a tendency to recur. Whereas bronchitis just means inflammation of the bronchi, which are the airways in your lungs. All right, when you breathe in, it goes down into the bronchi and then to the final bronchioles and then into these air sacs, which are like grapes. If some of you know the diagram of the lung, like, they're called alveoli. So bronchitis merely means inflammation of the airways, usually caused by a viral or a bacterial infection. So if you have an attack of bronchitis, the doctor treats you for bronchitis, that's it. You're well. You don't get bronchitis again, or you should not get bronchitis again. If you get bronchitis, let's say a second time, maybe a year later, let's not call it asthma so quickly. Maybe the child is in school, so it gets infected easily, so we get another attack of bronchitis. But if you get 3-4 attacks recurrent all the time, and if you have a family history of asthma, then eventually this is actually called asthma and not bronchitis. By definition, asthma is something which is recurrent. Yeah, it kind of doesn't go away. It just goes, it gets better, then it's calm for a while, there's no trigger, the child is A-OK. And then there's a trigger, then they get back the attack.
Okay, I would like to add on to that question. So, but actually, if a child has asthma, they have higher tendency of getting bronchitis, do they?
Yes, they do, because the airways are more sensitive. They react more to the viruses which are in the environment. So that's why, I mean, let's say, we're not talking about the COVID vaccine here because that's a bit later. But let's say talking about the influenza vaccine, we do recommend, especially children with a high risk, for example, like what I said, eczema and family history and all that, to go for the influenza vaccination because your airways are more sensitive. It gets triggered more easily by viruses. So go for the vaccines which are available, which can prevent disease. So this is what we mean, yeah.
Okay,
it is a bit more easy to trigger.
All right. Okay. There's another question from Sindhu Subramaniam.
Hi.
Okay. Hi, doctor. Is there any long-term or short-term side effects from inhalers?
The answer is no. Okay, so the reliever inhaler is not used for long time. It's only perhaps used for a week, sometimes maybe 10 days to relieve the symptoms of the cough and the shortness of breath and all that the child may suffer. And then moving on to the controller inhaler, which sometimes meant to use for months, like usually because we need to control the inflammation. These are not giving side effects because these are all inhaled locally into our lung. That means they only work on the local area. They're not being so-called absorbed into the body system. So, in that sense, it is safer. But you don't say, oh, I'm afraid of the side effects, so I don't want to use the inhaler, because then you see you have permanent damage to your child's lungs. So you have to balance it, but neither do we want you to be doctors. Your own regular doctor will judge. Maybe you're okay at a certain dose of control inhaler for a couple of months already, and then you're all stable and well. There's such a thing as a taper down dose. Taper down, it's a tapering dose and all that. And then if the child is symptom free for a while, then we can actually probably say no medication for a while, and then we assess the situation as we go along. But equally, you should not just say, oh, I'm afraid of side effects. Oh, I don't want to use the inhaler. It's too long. 2 weeks. Oh, I'm going to stop it like that. Always with guidance from a medical practitioner is advised.
Yes, so go back to our long-term consequences as we mentioned earlier. So if you don't control it earlier, you may lead to a worse condition of the disease. Correct. So the key word here is to have correct and medication and follow up with your doctor.
And control, right? You have to control it. Don't just treat the acute symptoms, control the long-term sort of consequences.
Okay, there is another question from Eileen Key. How young should we start teaching the child on how to use the nebulizer?
I think that question, Eileen, not to say you want to how young you want to teach your child to use a nebulizer. I mean, usually that nebulizer is administered by the parent or the caregiver, so the child doesn't need to learn anything. It just learns to tolerate the mask being held over the face and breathe without crying and getting too upset. So that's talking about, let's say, using even any spacer or inhaler device. I mean, the child does not use it. We just want the child to be able to feel comfortable with whatever we are putting over the child's face, whether it be a mask from a spacer or from a nebulizer. There's nothing to learn. We just ask them to breathe normally. We're not asking them to take a deep breath in, hold your breath, and then breathe out. They just breathe normally. It's a normal airflow, so basically to feel comfortable, because when you cry and get upset, then your breaths are interrupted. You don't get enough of a nice inhalation, and then so some of the medicines may not actually get into your lungs properly. Okay, Eileen?
Okay, yeah. There is another one, Carmen Yin. Okay, we mentioned about the hereditary effect of asthma, right?
Yes.
So if parents have asthma, does it mean that the children will have it for sure?
The answer is no. Not at all, not guaranteed, oh sure you get none, not at all. But your risk is slightly higher. So that's why we just say, just be careful. Just be careful. Not to say get too kanchiong. Just be careful, just do your best as parents. As I've said before, breastfeed if you can when you have a baby, that sort of thing. General measures. So please don't think that, yes, it is definitely going to happen to you.
Okay. So I think, okay guys, once again, don't forget to answer the question in the comment box, pinned in the comment box below. The question is, can children still have physical activities if they have asthma? Okay, remember to hashtag Caring Pharmacy and hashtag Omron to comment together with your answer. We will then select and PM 5 winners with the most accurate answer. And don't forget to like, share, and tag 3 of your friends to increase the chances of winning. Okay, I think that's the end of the sharing session. To the audiences who are joining halfway, please remember to answer the question pinned down for you to stand a chance to win away 5 units of the Omron ear thermometer TH839S after this session. Okay. Before we end our session, Dr. Khoo, is there any advice that you would like to give to our audiences who are watching the live stream now?
So first of all, I just want to thank everybody for tuning in, and I hope we were able to share some knowledge and info to all of you who are listening. My message to parents who have children with asthma is that let them lead a normal life, okay? Don't think that they're handicapped in any way, because they are just children with a bit of allergic disorder of the lung, which need not trouble them if you manage it well. Let them play normally, exercise. Very important, outdoors. Sunlight is a great vitamin booster. Vitamin D is excellent for immune system. So don't keep them indoors and think that if they run outside, they will get short of breath and they will trigger an asthma attack and all that. So nothing of the sort. So don't restrict them. Let them lead a normal life. Give them normal food. No cutting away veggies and fruits and all that because it's too cooling or whatever, that sort of story. Normal. Keep the home environment as healthy and kind of clean as you can. Try not to depend overly on devices like air conditioning, a bit of fresh air, well-ventilated rooms, etc. And then for many, a child can get so much better. And I can't say they outgrow their asthma, but they don't have any symptoms as they grow up. So parents, that's my message to you. Let them lead normal lives, okay? All right.
Okay. Thank you very much, Dr. Khoo. I think I've learned a lot today, and I'm sure that the audiences do too. Okay, and thank you all to our audiences for tuning in, and don't forget to like our Caring FB page and share this video with all your friends and family. Bye.
Bye everyone. Have a great weekend. Bye-bye.